My name is Catherine Robertson. I'm a physician here at UC San Diego Health. I'm the chief of sports medicine here, and I'm an orthopedic surgeon with fellowship training in sports medicine. So a lot of what I do is treat athletes, but I treat athletes of all shapes and sizes and ages in lots of different sports. Being a sports medicine doctor, a lot of what you're doing is kind of reactive. You know, you're treating people when they get injured, but what we really want to do is we want to be proactive. We want to do some prevention. We want to do the best that we can, whether it's through injury prevention exercises, whether it's through education, whether it's through nutrition, sleep management. There are a ton of other things that are kind of, you know, some new, some old, that we're trying to incorporate to kind of keep these athletes as fit and on the field as we're able to be. The patients all have something to teach us, and you know, when we try to learn from the patients and really understand where they're coming from, I think we do a much better job taking care of them. You know, a lot of what I'm doing is surgery, but it's not all surgical care. You know, it's figuring out what's best for the patient and really trying to individualize that care to give them what they need. And sometimes that's a surgery, sometimes that's, you know, doing something different with their physical therapy or even changing their shoes. I mean, it can really be A to Z. There are a bunch of interventions that we make, and I think keeping that, you know, as true as possible to the patient's needs is what gives them the best care. Regardless of whether you're, you know, 65 or 16, people still want to be active and people still value that time, and sometimes it's even people wanting to play with their grandkids, but that's okay. You know, those moments are very valuable to people, and I place a lot of value on getting people back to do those activities that are so important to them. I think that as we've kind of learned how to take care of these really elite, best in the world athletes, that's made us much more nimble and much more able to deliver state-of-the-art, innovative, great care that happens, you know, at the minute when that patient or when that athlete needs it. And I don't think we necessarily had that quite as well as we could have before we started working with these professional teams, but it's really transformed how our clinic works, how our system works, how we get people in for radiology. I think we've really made great strides in terms of taking better care of every single patient because of the opportunities we've had with these elite and professional athletes. When I got here a decade ago, sports medicine was really small, and it has grown tremendously since that time and grown in really exciting and innovative ways. And I think it's brought a lot from the university, where we can kind of add some of our research expertise and our clinical expertise and our innovation. I think we're giving back to the community, which we always want to do. So yeah, I mean, it's just been an incredible decade of growth for sports medicine at UC San Diego Health.